Hi there, I'm Kirti from Kirti Institute, and in this video, we are going to look at OET Writing subtest. I would like to give you an overview of OET Writing, so let's get started. In OET Writing, you will see the case note and a writing task. A case note is about the patient's case. Okay, you must have done case studies in which we take the history from the patient, right? We take patient's personal information, past medical history, past surgical history, social history, patient's presenting complaints, based on which, if you are a doctor, you will write the investigations or the treatment. If you are a nurse, you will be preparing nursing care plan. And then we write about the nursing management and progress, medical management and progress, and then we write discharge summary. So this kind of information will be given into the case note and it will be into the note forms. Okay, it won't be into the full sentences. You will have to prepare the sentences. And below the case note, you will be given the writing task, based on which you will have to write a formal letter. As I said, there are three types of letters: referral, transfer, and discharge for doctors and nurses. And if you want to know about the word count, it is approximately 180 to 200 words. Okay, your letter should be ideally no more than 200 words, but this is still approximate word limit. So if you are writing, suppose, up to 170 or 220, there should not be any problem. Okay, so let's learn what is the method of approaching OET writing subtest. So you will have to skip the case note first and see the writing task, which will be given at the bottom of the case note. Then read and understand the case notes. Select the appropriate information based on the reader, okay, to whom you are writing a letter and which is the important information for him or her, that you will have to select from the given case note, because all the given case notes will not be relevant to the reader, right? So you have to select the appropriate information, then plan your letter, then you start writing, and then you proofread. We are going to see each one of this point in detail. So let's get started with reading or identifying the key features from the writing task. While reading the writing task, you will have to identify four main things. First of all, what type of letter you are going to write, whether it is referral, transfer, or discharge. What is the profession of the recipient? Okay, who is the recipient? Okay, whether you are writing to a doctor, to a nurse, to a social worker, to the physiotherapist. Okay, who is the reader? Then you will have to identify the general purpose of writing a letter. I'm using the word general purpose, that means overall purpose of the letter. Okay, it can be ongoing care and management, okay, for assistance and further management, for definitive diagnosis and further treatment. It can be anything, but this purpose will be most probably mentioned into the writing task. If it is not in the writing task, it must be at the bottom part of your case note. Okay, so after reading the writing task, you may go through few sentences from the bottom of the case note. Then possibly you may come to know whether the patient is known or unknown to the reader. For example, if you are writing a letter to the patient's local GP or patient's family GP, the reader must be known. Okay, the local GP or family GP may be known to the patient. Suppose you have received the patient from the nursing home and you are sending patient back to the nursing home. In that case, also the patient is known. You can confirm whether patient is known or unknown by seeing to whom you are writing, and also you can match the addresses from the social history, patient social history, and the address of the writing task. Okay, so this is also another way to confirm whether the patient is known or unknown. Okay, the patient's residential address can be the nursing home, and you are writing to the same nursing home, which is the address in the writing task. So you will have to make sure whether patient is known to the reader or unknown to the reader, because your selection will differ if the patient is already known. Now, after reading the writing task, you will have to read the case notes. Now, the more you understand the case note, the greater chances of creating a good and logical story. So read and understand your case note very, very carefully. Okay, here I have provided 5 guided questions that will help you to improve your understanding of the case note. So number one is who you are. That means what's your role in this patient's study or patient's care. What is or are the patient's concerns? It is possible that there might be more than one concern. So you have to see how many concerns patients have, and who is the reader. For that reader, which concern is appropriate to mention, to elaborate about. Then, what have you done for the patient? That means to resolve that concern, what treatment you have provided as a team. When the patient was under your care, what all treatment is provided to the patient? What have you done for the patient? Okay, so what treatment you have provided? To whom you are handing over your patient? That means who is the reader and why? What is the reason to give handover to that particular person, to the recipient? Okay, so if you are trying to answer these 5 questions, you will improve your understanding of the case note. Okay, let's see the next. So for initial 5 minutes, you are only going to read the writing task and the case note. You will not be allowed to hold pen or pencil into your hand. That means you cannot begin to select the case note. Okay, so for this, you start reading the writing task, read the case notes, and understand it as deeper as you can. Then at the end of 5 minutes, you may start selecting the information. So whatever previous knowledge you have gained within 5 minutes, based on that, you may now start selecting the information. You can start putting tick mark for the information that you are definitely going to include. Okay, if there is any confusion whether this information should be included or not, because sometimes there are certain information like patient is diabetic, patient is hypertensive, okay, patient is obese, patient has allergic reactions. So this kind of information is as such that may relate with almost all kind of body system, right? So if you are confused that whether to include or not, you have to ask these 2 questions to yourself. Okay, number one is, does the reader knows the patient? Okay, as I said in the beginning, if the reader is already known, the reader must be knowing about the patient's medical history or the social history. We may not need to write it into the later. But if the reader is unknown, we may write if the reader is involved with that particular care. Okay, let's see question number 2. What aspect of the patient's care will the reader be involved with? Okay, that means suppose if you want to write that patient smokes 20 cigarettes a day. So you have to think that whether the recipient or the reader of the letter is going to solve this problem. Okay, whether he's going to deal with the smoking cessation, or whether higher amount of smoking is going to interrupt the care or treatment that he is going to provide. So if he's going to do something with smoking, you have to write. If not, don't mention. Okay, so you have to select the information based on the reader's qualification and expertise, and you should not include the information that does not impact the care or the course of the action to be provided, to be completed by the reader. Okay, let's move to the next slide. Planning. Okay, so what should be there in planning? Suppose you have selected a lot of information. Okay, so now you will have to plan. Okay, you will have to think that what all information should be included. Okay, so here you might have selected some of the information from the top of the case note, some of the information from the middle portion of the case note, and some of the information from the end part of the case note. So it is possible that to create a logical story, you may need to group the information together, to link the ideas together, to have a very meaningful and creative story. Okay, then you have to think about the organization of the information. That means organization of the paragraph. Okay, you can organize the information either chronologically or thematically. Like chronologically means as the patient has presented to you. For example, you are in a clinic, so patient might have come 3 months back, then 2 months back, and then today. So you can write 3 months back's history first, then followed by 2 months back history and today's history. So based on the patient's presentation to you. Second is thematically, means according to the priority of information. If you're transferring the patient via ambulance, you suspect that patient is having myocardial infarction. Okay, in that case, definitely the reader need to know about the emergency first. Okay, so you will prioritize your information, okay, according to the degree of importance. So you have to write the important information as a first body paragraph, followed by less important information. Okay, initially during your planning phase you can make points, okay, in the rough page. In the answer booklet, the last page would be your rough page. So if you are not sure, if you are not confident, when you are starting to learn about your writing subtest, if it is a practice sessions, you may make points, okay, like these 3 points would be in my first body paragraph, these 3 points would be in my second body paragraph, remaining would be in the last paragraph. Okay, so like that you can make points in your rough page. Create a logical story, okay, because the ideas should be linked together. The information within the paragraph also should be appropriate, and the paragraphing of the information also should be appropriate. The reader should be able to understand what is the problem, what have you done, and what he or she has to do. Okay, then think about the correct tenses to be used. It is very important to write or use correct tenses so that the reader can understand that at what time how much work was done, okay, or will be done. Now here is writing letter format. Okay, you can start writing from the date. Okay, this will be the today's date, your examination date, okay, the day on which you are writing a letter, that date has to be mentioned over here. Then you will have to leave one line and write the recipient's name if given in the task. Sometimes they mention the name of the recipient, sometimes they don't. If it is not given, you can move to the profession. Okay, if it is given, you should start with the name, then write profession, then write clinic or hospital's name, then clinic or hospital's address. This all information will be given into the writing task. So you are just going to copy paste it. You are going to just see and write over here. Then you should leave one line and write RE line. Okay, that is here RE means regarding. Then you can write patient's name and age. Here I have given the example, Mr. Darwish Woods, a 77-year-old. Make sure if you are putting hyphen, you should have article A or N based on the number. Okay, now you can write, then you will have to skip one line and write the salutation, dear Miss Brown. If the name is given, like here the recipient is Miss Smith Brown, so here you can write dear Miss, that will be the title, and Brown. Brown is a family name, so you should write that family name over here. Okay, if the name of the recipient is not given, you may address by the profession, okay, by the designation, dear director, dear nurse, dear doctor, like that also you may start. Now, one thing to point out is that this date can be written over here after the address. Okay, you have to leave one line and write the date after this address. That will be the today's date. And this RE line and salutation can also be interchanged. Okay, you can write the salutation first and then the RE line, or you can write the RE line first and then the salutation. It's up to you how you want to organize. But once you make your mind every time practice at the same place, so that in the real exam, there won't be any chances that you are forgetting something to write. Okay. After the salutation, leave one line again and start with introduction. In introduction, you will have to mention three main things. That is patient's name, main medical issue, and clear purpose of writing a letter. These three things must be there in your introduction paragraph. Okay, so the reader will come to know that, okay, this is the patient, this is the problem, and this is what I have to do. Okay, so this should be your introduction paragraph. Then you can move to the body paragraphs. As I already mentioned, you can organize chronologically or according to the degree of importance. The last paragraph is known as recommendation paragraph or request paragraph. Okay, so in last paragraph, you are elaborating your purpose. For example, your purpose of writing is ongoing care and management, for example. Here you will have to elaborate what ongoing care and management you want the nurse to provide. Okay, like you may want the nurse to provide daily medications, or to change the dressing every day, to assess the patient's compliance to the dietary measures, okay, or anything. it can be there, but whatever the reader is going to do or arrange, that has to be elaborated properly into the last paragraph. Then you will have to leave one line and write a closing phrase like, please feel free to contact me for any queries. Or should you require any further information, please do not hesitate to contact me. This is just a one kind of formality, and this is not going to be considered into your word count. Okay, initially I said that you have to write one letter between 180 to 200 words. So that word count will start from the introduction till your last body paragraph. Okay, then the closing phrase, then you have to leave one line, then write the sign off. Sign off is yours sincerely or yours faithfully. Interesting. When to use faithfully and when to use sincerely. Suppose if I already know the reader to whom I am writing a letter, then I can close it with yours sincerely because it is less formal language. Okay, like I know Miss Smith Brown, but my relation with Smith Brown is formal only for the professional reason. So I will use less formal language with yours sincerely. But suppose if I want to write an email or letter to OET official, okay, in Melbourne, I don't know who is going to receive my letter. I don't know who is going to read my email. So the name of the recipient in that case will not be given, okay, and I will close with yours faithfully, which is a pure formal relationship, okay, a pure formal letter. Then that means if the name is given, you will have to close with sincerely. If the name of the reader is not given, you will have to close with faithfully. Okay, leave one line again, write your name only if given in the task. Okay, sometimes they start like, you are Sarina Chai, a registered nurse working for so and so patient. So for that day, your name is Sarina Chai, and you will have to close with that given name. Okay, Sarina Chai. Then write your designation, registered nurse. All right, this is the layout. This is the format of your letter. I hope you understood. Now, once you finish your writing, it's vital to proofread. Okay, you will have to read your own letter and make sure you have not repeated any mistake that has been corrected by your trainer. Okay, so just make sure, and if you're doing so, you will be able to identify your 2 to 3 mistakes. Sometimes that makes a huge change, right, in the OET exam. So this is about the writing. Now time management, this is very, very important, okay, that you make sure you are managing time appropriately. Even if when you are practicing at home, you will have to do it with right time management, because the writing would be the third test on the test day. Okay, first will be the listening, then reading, then writing. And in some of the countries it starts with speaking, then listening, reading, and writing. So when you're writing, okay, your level of focus might have decreased, okay, after another tests, okay, another subtests. So you make sure that you are appearing for at least one mock test. It is not necessary that you go to the center or you go to the any trainer. If you have a good official material, you can sit at home by your own and practice listening, reading, writing, and speaking with single sitting. You will be able to realize how much time pressure affects your performance. Okay, let's see the time management for OET writing subtest. You will be given total 45 minutes, out of which first 5 minutes will be only for the reading. Okay, you will have to read only for initial 5 minutes. Take next 5 minutes for the selection of the information. Okay, it does not take whole 5 minutes. It may take 3 to 5 minutes. Okay, but not more than 5 minutes. Then plan your letter. This is very, very important phase. Without planning, if you start writing a letter, it is possible that at the end you may regret, that you may feel that I would have presented much better than how you performed. Okay, so to avoid such kind of things, you can just plan your letter, be sure what you are going to write where, and if your ideas are clear, if your story is very clear in your mind, the writing won't take more than 25 to 30 minutes. Okay, you spare only 2 minutes of time, okay, for the proofreading, for going through your own letter. Okay, but time management is very important part of OET writing subtest, even any subtest. Okay, so make sure that you are doing it appropriately. I hope you like this video. If it is so, you please subscribe to my channel and hit the red bell button, and you will be notified whenever I'm uploading something new. Thank you so much.